You're at home, alone, and a strange pressure starts building in your chest. Not the dramatic clutch your chest and collapse pain you've seen in movies. Just a heaviness, maybe some discomfort in your jaw, a cold sweat you can't explain. Your first thought is probably going to be, this is nothing. This is probably just heartburn. I'll sit down for a minute and see if it passes. That single decision, waiting to see if it passes, is the most common mistake I have watched cost people their heart muscle and sometimes their life. What you do in the next 10 to 15 minutes after that feeling starts can be the entire difference between walking out of a hospital with a full recovery or living the rest of your life with permanent heart damage that never needed to happen. I am Dr. James Parker, and today's video is different from anything else on this channel because this isn't about long-term prevention or building a healthier routine over months. This is about the exact 3 things you need to do in the moment a heart attack may be happening, whether it's happening to you or to someone standing right next to you. I want you to actually watch this entire video, not skim it, because the information in the next 20 minutes could genuinely be the difference between life and death for you or someone you love. There's one core idea I want you to hold on to through everything we're about to cover, a phrase used throughout emergency cardiology, and it's simply this: time is muscle. The longer a blocked artery stays blocked, the more of your heart muscle dies from lack of oxygen permanently, and every single minute that passes without treatment makes that damage worse. That's exactly why what you do in the first few minutes matters as much as it does. Before we get into the 3 critical actions, I need to spend a few minutes making sure you can actually recognize what a heart attack looks and feels like, because this is where the most dangerous mistake of all begins, and it begins before anyone even picks up the phone. Movies and television have trained almost all of us to expect a heart attack to look one specific way, someone clutching their chest dramatically and collapsing suddenly. Real heart attacks very often look nothing like that. Common warning signs include chest pressure or heaviness, a tightness or squeezing sensation rather than a sharp pain, discomfort that spreads outward into the arm, discomfort in the jaw or neck, discomfort in the back or upper stomach that can genuinely feel like indigestion, a cold sweat that comes on without explanation, shortness of breath, nausea, lightheadedness, and sometimes simply a sudden, unexplained exhaustion that feels disproportionate to anything you've been doing. I want to highlight something particularly important here. Women and people with diabetes are considerably more likely to experience quieter, less classic symptoms, sometimes without any chest pain at all, which is exactly why so many heart attacks in these groups go unrecognized until they've already become far more serious. If something feels genuinely wrong in your chest, your upper body, or your breathing, and it doesn't have an obvious, harmless explanation, I want you to take it seriously immediately, rather than waiting to see if it fits the dramatic picture you've seen on screen. Now let's walk through the 3 critical actions in the exact order they matter most. Action number 1 is call 911 immediately. I want to be extremely direct about this because hesitation here is the single most dangerous mistake people make. Do not wait to see if the symptoms disappear on their own. Do not decide to lie down for 20 minutes and reassess. Do not take an over-the-counter antacid and wait to see if it was simply indigestion after all. Call immediately, the moment something feels genuinely wrong. When you call, say clearly and specifically, "I think I am having a heart attack." Clear, direct language like this helps the dispatcher immediately understand the severity of the situation and prioritize accordingly, rather than working through a slower series of questions to figure out what's happening. I also need to address something I see constantly, and it genuinely frightens me every time. Do not drive yourself to the hospital, and do not have someone drive you there privately instead of calling an ambulance. This feels efficient in the moment, especially if you think the hospital isn't far. But here's the danger nobody thinks about until it's too late. A heart attack can trigger a dangerous heart rhythm at any moment, one that can cause sudden loss of consciousness, and if that happens while you're behind the wheel, you put yourself and everyone else on the road at serious risk. An ambulance, by contrast, is not simply a faster way to get to a hospital. Paramedics can begin real evaluation and treatment before you ever arrive, including administering oxygen, starting an IV, running an EKG to identify exactly what's happening with your heart, and communicating ahead to the hospital so a treatment team is already prepared and waiting the moment you arrive. Calling 911 gets professional treatment started as quickly as humanly possible, often many minutes earlier than waiting until arrival at an emergency room entrance. Action number 2 is chewing aspirin, if it's appropriate for your specific situation. Here's the mechanism behind why this matters. The large majority of heart attacks are caused by a blood clot forming and blocking a coronary artery, the specific blood vessels that supply your heart muscle with oxygen. Aspirin works by making platelets, the small components in your blood responsible for clotting, less sticky, which helps slow the growth of that clot while you're waiting for emergency medical care to arrive and take over. The script I want you to remember is chewing, specifically, rather than swallowing a tablet whole, since chewing allows the aspirin to begin absorbing into your system considerably faster than swallowing it would. A regular strength aspirin, chewed, or 4 low-dose aspirin tablets chewed together, is the guidance here, provided you don't have a known allergy to aspirin or another specific medical reason your doctor has told you aspirin isn't appropriate for you. I want to be completely clear about something important. Aspirin is an additional step that happens after you've called for help, never a replacement for calling 911 in the first place. If you're ever uncertain whether aspirin is appropriate for your specific situation, this is precisely the kind of question the 911 dispatcher on the phone with you can help guide you through in the moment, since they're trained specifically for exactly this kind of emergency guidance. Action number 3 is stopping all movement and staying calm. This might sound like the least important of the 3 actions, but physiologically, it plays a direct, measurable role in what happens to your heart during those critical minutes. Sit down immediately and stop any physical activity entirely. Avoid walking around the house. Avoid climbing stairs. Avoid any form of exertion, even something that feels minor, like tidying up while you wait. Here's exactly why this matters so much. When your coronary artery is blocked, the portion of heart muscle downstream of that blockage is already struggling to receive enough oxygen. Any physical exertion increases your heart's overall workload and its oxygen demand at the exact moment your heart has the least capacity to meet that demand, which can worsen the damage occurring in real time. Staying still and calm minimizes that additional demand, giving the heart muscle the best possible chance of surviving until treatment arrives. Alongside stopping movement, practice slow, controlled breathing specifically, since this can genuinely help reduce your body's overall stress response, and a heightened stress response itself raises heart rate and blood pressure, adding further unnecessary strain during an already dangerous moment. Loosen any tight clothing around your chest and neck, since anything constrictive can add to your sense of pressure and make breathing feel more difficult than it needs to. And if you're alone in your home, take a moment to unlock your front door before sitting back down so that paramedics arriving can reach you immediately rather than losing critical time if you become unable to answer the door yourself. I want to pause here and give you the simple formula to remember all 3 of these actions together, because in a moment of genuine fear, complicated instructions are hard to hold on to. Call, chew, rest. Call 911 immediately. Chew aspirin if it's appropriate for you. Rest by sitting down, staying still, and staying as calm as you can manage while help is on the way. Now I need to cover something critically important, a distinction that could change how you respond if a moment like this happens to someone you love. A heart attack and cardiac arrest are not the same thing, even though people often use the terms interchangeably, and understanding the difference determines what you should actually do. A heart attack is fundamentally a plumbing problem. Blood flow to part of the heart muscle is blocked by a clot, but the heart itself is generally still beating and pumping blood throughout the rest of the body. Someone having a heart attack is usually still conscious, still able to speak, still able to describe what they're feeling and follow instructions, which is exactly why the 3 steps we just covered, call, chew, rest, apply directly to this situation. Cardiac arrest is fundamentally different and far more immediately life-threatening. It's an electrical problem, where the heart's electrical rhythm becomes so chaotic that the heart stops pumping blood effectively altogether. Someone in cardiac arrest becomes unresponsive very quickly and stops breathing normally, and unlike a heart attack, they cannot speak to you, follow instructions, or call for help themselves. It's important to understand that a heart attack can absolutely lead to cardiac arrest if the heart's electrical rhythm becomes disrupted as a direct result of the blockage and the strain it's placing on the heart muscle, which is exactly why staying with someone experiencing heart attack symptoms rather than leaving them alone matters so much. If someone collapses in front of you, becomes unresponsive, and isn't breathing normally, the response changes immediately and completely, because you're very likely now dealing with cardiac arrest rather than an ongoing heart attack. And this situation requires an entirely different, more urgent kind of action from you. Call 911 immediately and put your phone on speaker so your hands are completely free to act while you stay on the line with the dispatcher. Begin hands-only CPR right away without waiting for anything else. Push hard and fast in the center of the chest using the heel of your hand with your other hand layered on top, and let the dispatcher on the phone help guide your pace and depth if you're uncertain. If an AED, an automated external defibrillator, is available anywhere nearby, use it immediately. These devices are specifically designed with clear voice instructions that walk you through exactly what to do, even if you've never used one before in your life. Continue CPR without stopping until professional emergency help physically arrives and takes over. I want to address one specific myth directly because it circulates constantly and it genuinely concerns me every time I hear it repeated. What's sometimes called cough CPR, the idea of repeatedly coughing forcefully to somehow keep yourself conscious during a heart attack while alone, is not a reliable technique, and it should never be relied upon as any kind of substitute for calling 911 and following the actual steps we've covered today. Let's walk through the dangerous mistakes one more time clearly, because avoiding these matters just as much as knowing the correct steps. Waiting to see if symptoms disappear on their own, assuming it's simply indigestion, heartburn, ordinary fatigue, or a muscle strain, is the single most common and most costly mistake because it burns through exactly the minutes that matter most for limiting permanent heart damage. Driving yourself to the hospital or having someone drive you privately instead of calling an ambulance puts you at direct risk of losing consciousness behind the wheel, and it delays the medical treatment that could otherwise begin the moment paramedics arrive at your side. Relying on cough CPR as any kind of solution while experiencing a heart attack alone is simply not a dependable technique and shouldn't be trusted with your life. And taking aspirin as a substitute for calling 911 rather than as an addition to it misses the most critical, time-sensitive step of the entire response. I want to leave you with the complete picture, laid out simply, so you can genuinely remember it under pressure if this moment ever happens to you or someone you love. If you suspect a heart attack, symptoms like chest pressure, arm or jaw discomfort, cold sweat, shortness of breath, or unexplained exhaustion, the sequence is call, then chew aspirin if appropriate, then rest, sitting down, staying still, and staying as calm as possible while help arrives. If instead someone collapses and becomes unresponsive, not breathing normally, the sequence shifts entirely. Call, then begin hands-only CPR immediately, then use an AED if one is available, continuing until paramedics physically arrive and take over. The single most important idea underneath everything we've covered today is this: doing something, even imperfectly, is always better than doing nothing and simply waiting to see what happens. I made this video because I genuinely believe the information in it could save a life. Maybe someone watching right now, maybe someone they love. If you found this valuable, please share it with the people in your life, because the person who needs to know this information may never think to look it up themselves until the moment they urgently need it. Take a second and tap that like button as well. It helps this specific video reach more people before they're ever in this situation. And if you have a moment, tell me in the comments, did you know all 3 of these steps before watching today? Or did something here genuinely surprise you? I read every comment. Before you go, if you're someone who's building healthier long-term habits alongside knowing this critical emergency information, my last video is a natural companion to today's topic. It's called You Walk Every Day After 60. Stop making this mistake, and it walks through 7 small, common walking habits that quietly strain your joints and increase fall risk over time, along with exactly how to fix each one. Protecting your heart in an emergency and protecting your joints and mobility every single day are both part of the same larger goal, staying strong, safe, and independent as you age. I'll leave that video right here for you. I'm Dr. James Parker. Learn this, remember this, and share it with someone you love. I'll see you in the next one.